Let's take a careful look at leukemia, which we all know to be a blood cancer disease, or a cancer that affects blood cells and also affects the bone marrow. Let's take a careful look at it. If you look carefully, you would realize that leukemia management, to a large extent, can affect sensorineural hearing loss. Not only this, leukemia, to a large extent, also has issues with anemia. This is something we need to take note. Now let's look at sickle cell disease as well. Sickle cell disease is more of a sub-Saharan Africa disease. But you know the interesting thing? The most affected is West Africa. For sickle cell disease in sub-Saharan Africa, the most affected is West Africa. Now, you also agree with me that in the course of managing leukemia, therapy can affect hearing loss. Let's go to sickle cell disease as well. With sickle cell disease, the disease itself subjects patients to sensorineural hearing loss, especially those with the SC type, sickle cell, SC type. And you know the interesting thing? The C allele is very, very common in West Africa. Now, with heart disease, let's look at it from heart failure perspective. Leukemia is associated with heart failure. Sickle cell disease is associated with what? Heart failure. Let's now zero on ATTR variant V122I. Let's zero on that. In 2019, Batir, this is a research group, ATTR, a research group in France, did some work on association of V122I with sensorineural hearing loss. And this was also established. It's just one study online. We just have one study. So look at it from this perspective. I'm also going to do a presentation soon, hopefully tomorrow, on the association of V122I with heart failure. So French is saying that, the French team is saying that V122I is associated with sensorineural hearing loss. I am here to talk about V122I being associated with heart failure. I hope you see where we are heading toward. Leukemia, heart failure, hearing loss. Sickle cell disease, heart failure, hearing loss. V122I, heart failure, hearing loss. So let's look at this picture. West Africa, leukemia is among the first 10 cancers in West Africa. In fact, it's reference to Globacom 2020, leukemia is at position 9 in terms of incidence and prevalence. Sickle cell disease, as I told you earlier on, is also more, though we say it is in sub-Saharan Africa, it is more of a West African issue. So let's look at this. Sickle cell is genetic. In fact, that is also another point mutation. And research by Jacobson et al. They say that the V122I variant might be second most common to the sickle cell disease point mutation. So if I am sickle cell and I have inherited V122I again. And I have leukemia. What is my fate as far as heart failure is concerned? What is my fate as far as hearing loss is concerned? It is so obvious that there is a need to monitor V122I, that's the ATTR variant, which is known to have originated from West Africa, and also monitor sickle cell disease in leukemia patients. This is very, very important. So it is so obvious there is a need for us to monitor sickle cell disease and the ATTR variant V122 in leukemia patients.